And I want to commend everyone for their efforts to keep space between themselves and others. Staying at home and social distancing are some of the best strategies in the fight against a communicable disease, and as we talked about it here yesterday, it is working. Our efforts are making a real impact, and similar efforts across the nation are also helping. But we need to keep it up just a little bit longer if we want to end this crisis sooner rather than later. Today we're going to hear more from Supervisor Fletcher about social distancing, staying at home, and how that is playing out in our region. And then we'll have Dr. McDonald to give us a medical update. Then Dr. Wooten will follow up with some additional medical information and to reemphasize the point that this is National Public Health Week. And so today we're going to be acknowledging our first public health champion, which she will do in her comments. So we'll go ahead and get started with Supervisor Fletcher.
Thank you, Supervisor Cox, and good afternoon on this beautiful Friday afternoon. When we're encouraging folks to stay at home, we do appreciate the assist from the weather. We know San Diegans are reluctant to leave their house when it rains, so perhaps a little bit easier today. We do want to reiterate, though, that every day, whether it rains or shine, we have to continue to adhere to the orders. As you're going to continue to see, and you have seen in recent days, we are meeting this challenge in San Diego County. But our fight is far from over. If you remember when we started this, we declared a public health emergency before we had a single positive case because the risk to the community was that high. And we're at a point in the struggle and in the fight against coronavirus where the risk to the public remains very high. And so the actions that we take and continue to take over the coming weeks are going to be of utmost significance, and the commitment that we all make to ensure that we see through a good outcome is just as important today as it was the day that we started these orders, as it was at the beginning of this evolution. And so we ask you to continue to hold fast and hold strong. We will get through it. We will rebound, recover, and rebuild and come out of it. But the day to start that is not today. And today is the day to continue the actions that we're taking, knowing that it is saving lives. I also want to mention again, as we head into a weekend that many people observe of particular significance, to reiterate the call that we, within your household unit, you should enjoy the weekend, and if you celebrate Easter in whatever way you may do it, it is appropriate, of course, to do. But it is only within your household, within your family unit who you live with. We can't see congregations or groups getting together outside of those household units because that would be not only against the public health order, but it would be against the order of the folks who you love and care with and want to see. And during this difficulty, it is important to acknowledge how many people are struggling from economic anxiety, from uncertainty, from isolation. And if you're blessed and fortunate to have a household unit who you can physically be around, you should enjoy and appreciate that. But it's a good weekend to reach out to someone. To a neighbor, to a friend, call them, Zoom them, FaceTime them, yell out the window from more than 6 feet away. But it's an opportunity for each of us to make that extra effort to support someone else. And if you're in a position where you're able to financially support an organization who's helping those who are less in need, it's a wonderful time as a community to come together and continue to support each other as we go through this. I want to jump into our charts. As promised, we're going to give you an update on the Google Mobility Report. This is a useful tool that we think really measures in large part and helps us track our compliance. We shared these numbers with you about a week ago, but I want to show you here. So retail and recreation, this is how much people are moving around to these locations, is down 54% from the baseline. And the +4 there just means we got 4 percentage points better. It was only -50. And so the green represents an increase in what we hope the public is doing. And so it went from -50 to -54, which is a 4 percentage point positive jump. Grocery and pharmacy, again, we're seeing progress. The public continues to adhere to the orders. Parks, we saw a significant jump here, which really corresponds to the increased action and steps we took around parks. And so this is really encouraging, and we want to thank the public for truly committing and buying in with us in order to do it. 5% bump in transit stations. This does track right along what we're seeing with ridership in a lot of our transit systems. Workplace is 2%, and residential is +1. We're going to continue to update these every week just to give us a daily check-in and kind of a way for us to measure our progress and our success. But those numbers are encouraging, and we need them to continue and to stay in the green, continue to make positive progress towards the actions we've asked you to do. The second one is another interesting one that this data comes to us. Again, this is from a third-party vendor, Unicast. Unicast makes this data available publicly. It's related to cell phone utilization and usage and evaluating where those are. I want to be clear, the County of San Diego does no monitoring of any of this. We're simply sharing with you an available third-party app that gives a grade to the state of California as a whole in terms of physical distancing scorecard. State of California gets a B. You can see down there in Southern California, we've got a little bit of work to do to catch up with our neighbors to the north. I know in San Diego, we live in a mantra of beat LA, and we got a little bit of work to do here over the next week to get our score higher than Los Angeles. We'll continue to look for other metrics or things that help us measure our progress, but it's a way for us to really show the progress we're making as a community and to hopefully inspire continued commitment and continued action. Let's jump into our charts of the day. You will see for today we're reporting 65 new positive cases. That brings us to a total of 1,693. Our testing total is now over 23,000 with 1,255 tests reported yesterday. And again, we hope to see continued increase in tests and some encouraging news coming out of some of our health system partners about their new adoption of testing. Next chart you see is just the comparison of total tests to total positives, which continue to track generally consistent as we move through this. And then here you see the total positives, hospitalizations, estimated recoveries, ICUs, and the unfortunate loss of life, which we were reporting a few additional ones today. I want to point out particular importance that recoveries, again, as we stated every day, is an estimated recovery based on the date of positive test, removing that person 14 days later, adjusting for the loss of life. The recoveries have nothing to do with the hospitalizations. The recovery statistic ties to positive test. It does not tie to hospitalizations and does not tie to ICU usage. Motel rooms, a slight uptick in our public health rooms, both in occupied and guest. Regional Task Force on Homeless Rooms, slight uptick in occupied, flat in terms of guests. Our outreach efforts, our 211 calls, nurse triage line calls are up, epi calls are up, hygiene calls are up, hand washing stations are flat pending any additional requests, and we have 2 new portable toilets that have been distributed. The personal protective equipment is up in every single category. While we continue to fight to acquire more and get more and be able to provide more, we do continue to distribute what we have on hand based on the estimated need and what we are able to fulfill. And we are pushing almost 2 million individual items of personal protective equipment. And again, today's ventilator report changed from yesterday, which has more to do with all 23 of 23 hospitals reporting. We now stand at 554 ventilators in our healthcare system partners that are available today. Uptick of 1 in the county stockpile at 93 that are ready to reserve. And we continue to await further information from the state on our request, as well as the arrival of those we have ordered on the private market. With that, I would like to introduce Dr. Eric McDonald for his public health update.
Thank you, Supervisor Fletcher. I think if I have a slide that comes up here. There we go. Thank you for letting me do this update. And I just wanted to say that these numbers come from the Johns Hopkins dashboard from about 10 o'clock this morning. And as you can see, there are globally almost 1.7 million cases worldwide with over 100,000 deaths. Nationally, we're approaching almost 500,000 cases with over 18,000 deaths. In the state, there have been just over 20,000 cases with 552 deaths. This number is a little higher than the number that was briefed by the governor earlier today because of the way that Johns Hopkins does its tracking. And then, of course, locally, we've had almost 1,700 cases with 44 deaths. And the next slide. In a little bit of detail, the range of cases in age goes from 3 months to 100 years of age. 891, or just over half, are between the ages of 20 and 49. 867, or 51%, are male. 21%, or 374, have been hospitalized. And this includes 140 individuals who were admitted to the intensive care unit. And then lastly, the 44 deaths represent 2.6 of the total number of cases. And with some detail on those, all of them had underlying medical conditions. 51% were male, and we have a breakdown of 34 of the cases in which we know the race and ethnicity. 62%, or 21, were white. 29%, or 10, were Hispanic. 6%, or 2, were Asian. 3%, or 1, were multiple races. None of those who died were African American, Pacific Islanders, or American Indian. And the other 10 cases we don't have any race, ethnicity information on. And again, to the families of those who have lost a loved one, we do extend our deepest sympathies to you and your family. Regarding the outbreaks in congregate and community settings, we have a total of 27 confirmed outbreaks. This includes 19 outbreaks at congregate facilities, such as skilled nursing facilities and assisted living centers. This represents 180 of the cases and 22 of the deaths. So half of the deaths that we have reported so far in this pandemic locally have been in these congregate facilities. There are 8 outbreaks that are in community settings, and this represents a total of 38 cases and 1 death. And I just wanted to, before I turn it over to Dr. Wooten, just make a comment that this is an important week for many in the community, especially those of Jewish and Christian traditions. Today especially is a day in which we can reflect on sacrifices that were made to save other people. And I just want to acknowledge that there are many San Diegans who have sacrificed a lot in the last few weeks. Some people have lost work, they've lost schooling, they've lost opportunity to do things that they enjoy, and some of them have lost things that aren't easily measured, like access to someone in a hospital or a skilled nursing facility. These sacrifices are real, and we recognize that here at the county and want to acknowledge that. And as a public health professional, I just want to let you know that those sacrifices make a difference. We talk about bending the curve, but that doesn't really mean a lot. It looks good on a graph, and we talk about it, but what it really means is that we're saving lives. And so for those who have made those sacrifices, we thank you and want to let you know that it directly affects other people's lives and well-being. So thank you. I turn over to Dr. Wooten.
Thank you, Dr. McDonald. In recognition of the 2020 Live Well San Diego Public Health Champion Awards, today we will announce the first recipient. This virtual event is held as a signatory event for National Public Health Week, which this year is in its 25th year, with the theme of looking back to move forward. This year's theme award recipient is the Challenged Athletes Foundation. 26 years ago, 3 friends organized a fundraiser for their dear friend Jim McLaurin, an amputee who had suffered a second tragic accident that left him quadriplegic. The efforts of these 3 friends launched a global change in the way athletes with physical challenges are perceived, and today is embodied in the Challenged Athletes Foundation. The Challenged Athletes Foundation exists to provide what is needed, when it is needed, and to those who have the greatest need. The organization is a true public health champion that embodies this year's theme of over 25 years of looking back and moving forward to advance the health and well-being of those with physical challenges. Please see our County News Center for the full description of today's theme recipient. Lastly, I want to also thank all of our local volunteers throughout the county who are helping to support the most vulnerable populations during a response to this COVID-19 pandemic. Thank you to everyone. Now please welcome Chairman Cox back to the podium.
We're going to get right to the questions. Again, as you are called up, if you are not identified in the introduction by name and outlet, please do so. And we'll go to the first question right now.
Voice of San Diego, please state your name and question.
Hey, this is Jesse Marks, and my questions are directed at Dr. McDonald. Thanks for taking them. So my questions have to do with contact tracing. Last week, you told one of my colleagues that 100 people or so had been helping with the interview and investigations process. But, well, first I was curious whether that number has grown, and it seems clear to me that governments are starting to shift more towards a version of contact tracing which is digital and which would entail the use of smartphones. So can you tell us whether the county is evaluating any apps or companies and how you're thinking potentially about that digital process as well as where privacy and consent factors into the equation?
Well, thank you for that question. It's actually very interesting talking about the different techniques and possibilities for contact tracing. We are not currently using or engaging with any specific companies on any kind of electronic contact tracing. I think you do, appropriately refer to issues of privacy that may be involved with that kind of effort. But the number of individuals we have doing these current contact tracings are still just under 100. We released a health officer order yesterday to try to leverage some of our providers in the community to do some of this contact tracing and identification as early as possible. When you rely on interviews of individuals, there's often a delay in identifying individuals. So when a provider gets a test and gives it to the patient, that is the earliest opportunity to perhaps identify, especially household and close contacts. And it is best actually for the patient to make those identifications. And we find when we interview individuals that most of those close contacts have in fact already been identified. So we wanted to reinforce that interaction between a private or a provider and a patient, and to give them some tools to do so, which were detailed in our health alert yesterday. But this is an ongoing challenge, trying to identify close contacts in a timely manner to be able to get them the information that they need to be aware of signs and symptoms. Having said that, the advice to the public is still the same. That is, that we want them to be able to identify the signs and symptoms and quickly isolate themselves, and to assume that interacting in public environments or even the essential work environment might expose them to COVID, so that if they develop those signs and symptoms, they should immediately self-isolate.
So I do have one follow-up on that. Apple and Google announced today that they would be tweaking their operating system so that they could actually trace patients themselves, and they offered to give up that information to public health professionals. I wonder, though, if you worry that that might give people a false sense of confidence to go back into the world, and just how you're thinking generally about the outsourcing of this process to the private sector.
Well, again, I think that we don't have current engagement with any companies to that end at this point. I think it is intriguing and it will be important to leverage electronic capabilities and apps to be able to get information, to identify information, but we currently don't have that capability now. Google and Apple haven't contacted us at the local health department. Perhaps they've done that at the state level, and there may be some conversations there, but I'm personally unaware of those.
Thank you.
Okay, we only have one other call in. We'll go ahead and take that call now, then we'll go to the texted questions.
NBC 7, please state your name and question.
This is Priya Sridhar from NBC 7. Previously, we had heard that the actual number of positive cases in the county was perhaps 10 times greater than the number you were reporting because of a shortage of tests. Now that testing is more widely available, do you think that the numbers we're seeing today are more accurate than before?
Dr. McDonald will answer that question.
Well, I think that the numbers that are coming into us are indeed accurate, so that we're getting good results on the PCR tests that we are learning about. But we do know that testing capability is far under what it needs to be to identify true cases in the community. And again, we know that anecdotally, and we know that from, again, speaking with patients when they are identified and learning about close contacts of theirs who may have had mild symptoms that were resolved or mild symptoms that are continued but yet can be managed without actually contacting medical care. We still urge those individuals to in fact stay at home because if they don't need to be seen by medical care, they don't need to be tested if they're doing the right thing, especially if they're a contact with a known COVID patient. I made that estimate of approximately the number of people that may be out there based on just anecdotal evidence. We don't really know what the burden in the community is compared to the number of tests that are being reported. I would say that there's still a substantial gap, and really until there is much more plentiful testing, especially throughout the system to individuals who may have less access than others, that it's still an undercount.
Thank you.
Okay, we'll go to the first text question, and it has to do with public gatherings on Easter Sunday.
Yes, I'm going to combine the questions from Claudia, Univision, and Terry from the Union Tribune. They're essentially the same question, which is, what will the county be doing this weekend if any churches or religious community decides to defy the public health order, and will there be citations? If there are citations, how much will they be?
Well, first off, I want to thank our faith community. We've had a tremendous cooperation and support across all segments of San Diego throughout the duration of this. But in particular, our faith leaders have been some of the greatest leaders in terms of saying that you will gather in spirit and you will gather via technology or via video, but you will not gather in person. And we've seen a number of instances throughout America of particular faith communities who did not do that, who had significant outbreaks and significant problems. And so we're grateful for our faith leaders who have bought in and have really shared with the members of their congregation or their entity the importance of why we do this. And so we fully expect all of that cooperation to continue. As with any public health order, if it is not being followed, as we've talked about multiple times, law enforcement will enforce these orders, and you are subject to the penalties that have been walked through and outlined for violating the public health orders. But we certainly hope that that is not the case. We don't want to take law enforcement away from the job that we need them to do day in and day out to enforce the public health orders, and we don't anticipate any significant problems.
Thank you, Supervisor Fletcher.
This next question is one dealing with herd immunity and antibody testing, and Dr. McDonald's going to answer that question.
And this question comes from Kogo. Can the county address the herd immunity issue and explain how the antibody testing will determine whether some of us have had the virus, even though we've never had any symptoms and can be completely asymptomatic, but still have the virus antibodies? They're a little confused.
I think there's a couple of questions there. I think I'll deal first with herd immunity. One of the things that's important to know is one of the reasons we're having to do all of the things that we're doing for social distancing is this is a novel virus. It's never been in humans before, which means our herd has never seen it. There is no immunity. And as it's introduced into humans and here in San Diego in our population, a certain number of people are going to get infected and have symptoms, and a certain number are going to have no symptoms. It turns out that often young children have no symptoms at all, yet can have the virus and clear it, and essentially without any effects whatsoever. The older you are, the more likely it is that you'll come down with symptoms, and sometimes severe symptoms. And there are a couple of tests that are useful to help us learn about that. The first is the PCR test that we can actually detect the RNA of the virus. And the second is to look at your immune system to see how you have been able to fight off the virus. And the longer the virus has been present in your system, the more likely it is those antibodies are present. And that's the basis of these other antibody tests. when you have enough people in the community that have enough antibodies to fight off the infection, the community as a whole is protected. And that's one of the principles that we use to have very high rates of vaccination, for example, and vaccine preventable diseases. If you have a very highly contagious disease like measles, you have to have a very high number of people who are immune, have these antibodies in their system, in order for outbreaks not to occur. This particular virus is about as contagious, maybe a little more contagious than the flu, about as contagious as hepatitis A. And so we're going to need, in order to stop ongoing outbreaks, at least 70 to 80% of the population to have antibodies to be able to stop outbreaks completely. Now that's just extrapolating from old information and information about diseases we know about to this one, which we don't know a lot about. So we do hope that there'll be a vaccine eventually. We do hope that it's effective and can increase the immunity of everyone in the community, or the so-called herd immunity. But it's going to need to be at a certain level if this virus is continued to be passed from person to person in order for it to go away completely. We all hope that that's what happens, but we don't really know because, again, it's a novel virus. There are other coronaviruses that come and go with seasons. There are coronaviruses that cause the common cold, for example, and those tend to come back every winter just like the flu does. We don't know whether this virus will behave like that or whether it won't. And there was a third part to your question that had to do with, the antibody testing. Does it really indicate that you had this disease? And again, it depends on the antibody. Some antibodies are or tests are very, very good. They can say, yep, it's exactly this virus that I have antibodies to. Some are not so good. The one for hepatitis A, for example, is not that great. It tells you that you've been exposed to hepatitis A, but it may be that you're exposed to other viruses. For the coronavirus, we don't really know enough about the tests that are being used, and there's not enough of a track record to know that if a serology test says, hey, you're positive for coronavirus, do we know it's this coronavirus or is it other coronaviruses? And it's going to take a little time to really understand that, which is one of the reasons why these serology tests haven't really been incorporated into our decision-making at this point in time. We're learning a lot about it. We think that some of the serology tests are better than others, and those that look like they're going to be here quickly and are used by clinicians in the field will give us a better answer, but it won't give us necessarily a perfect answer or as good an answer as quickly as the PCR test does. That's a lot of answering, but hopefully that answered the three parts of the question.
Yes, thank you. This question is from Gary Worth with the Union Tribune. Half of our local deaths were from congregate facilities. Do you know how that compares to other communities, and do these facilities typically make up a significant percentage of COVID deaths, or does that seem unusually high here?
I don't know the exact comparison with other jurisdictions, but I can tell you that anecdotally, the skilled nursing facilities and assisted living facilities are the exact populations that are most at risk for bad outcomes, which is why one of the state's and locals' earliest interventions was to restrict access to these facilities and to give special precautions and warnings to anybody over the age of 65. So it makes sense that this would be a disproportionate group that the deaths and illnesses are coming from. Also, the nature of living close together and social distancing is much more difficult in those environments. So certainly it makes sense, and we do know that it is disproportionate across the country, but whether our exact percentage of 50% is more or less than other jurisdictions, I can't answer that question.
All right, thank you, Dr. McDonald.
This next question is dealing with essential businesses, and Supervisor Fletcher will answer that question.
Yes, this one is also from Gary. We've heard of car dealerships where sales floors are open because the management has told employees that they're essential businesses. Can you clarify if they are, and can you say who decided what businesses are and aren't essential? And if a business isn't essential but remains open, what enforcement actions might be taken?
Yeah, the governor's executive order surrounding essential and non-essential business is what is the law in the state of California, and you can go to the state's website and get a listing of their 14-page breakdown of what is essential and what is not essential. As it relates to this particular question, based on an understanding in the governor's executive order, auto repair facilities are essential. They should be operating with physical distancing and hygiene standards. They should be posting their plan for that outside, as well as providing that to their employees. In terms of auto sales, doing an online version of that is okay, but the retail component of auto sales should not be open in San Diego County, consistent with the governor's order. If there is a violation of any non-essential business that is open, the most effective way to report that is to go to 211sandiego.org, and you will see the link for non-essential businesses where you can share your observation, and that will be directed to the law enforcement agency in that jurisdiction. Your second alternative is to contact the non-emergency line for the law enforcement entity that is responsible for that jurisdiction, the city that they're in, or in the unincorporated, that would be the county sheriff.
Thank you, Supervisor Fletcher.
This next question is going to be answered by Dr. McDonald, and it has to do with feeding seniors.
Sarah Cohen from ABC 10. Today, Governor Gavin Newsom announced a partnership between FEMA and California restaurants to feed at-risk seniors 3 meals a day. Are you aware of how this partnership may work on a local level, and what process do seniors need to follow to get help? How can local restaurants help out?
Wow, I really don't have the answer to that question. I can tell you that there are some organizations in San Diego that already do this type of work, that have been doing it even before the outbreak began, and that also serve other special needs groups to make sure that they have hot meals delivered to them, often when they can't prepare it themselves. But this specific program, I don't have any information on. I'm sure that someone in our Aging and Independent Services or one of our other branches of the county can get back to you on this.
Thank you for winging that, Dr. McDonald.
That completes our media calls for today. Just a couple of observations. Throughout the past few weeks, we've seen San Diegans step up in large and small ways to help their neighbors and their community at large. Today, I want to tell you about what some of our athletes have been doing. When word got out that frontline healthcare workers at Scripps Green Hospital in La Jolla were having to rely on vending machines for late-night meals during their night shifts, a few well-known athletes got together and decided to step up to the plate. Now, you may know Dave Roberts as a manager of our rival Los Angeles Dodgers, but he's also a San Diego resident who grew up and played baseball here. When he heard the news, he and his wife contacted friends who owned a restaurant in La Jolla called Sushi on the Rock. They called Colorado Rockies manager Bud Black, who, as we also know, was once our manager here at the Padres, and the effort snowballed from there, bringing in Padres home run baseman Manny Machado and Padres Hall of Famer Trevor Hoffman to help out. The effort has led to meal deliveries on Mondays and Tuesdays that have been going on for a couple of weeks now, and they hope to expand and deliver more meals to more hospitals. So my thanks to the restaurant owners, their customers who also helped out, and our local baseball community. Mark that down in your scorebook as another save for Trevor Hoffman and a home run for Manny Machado. We will be back tomorrow, but I want to let you know and give you a heads up that we will not be providing a media briefing on Sunday. However, the county will be sending out a media advisory with the latest numbers and updates later that afternoon on Sunday, and we'll return back here on Monday at our regular time at 2:30 for the media briefings. Thank you, and remember, live well, and to stay well, stay at home. Thank you.